Cast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's webinar on tackling select all the apply questions. I'm sure many of you are feeling a little frustrated by now with these type of questions, as they seem to be the hardest questions you will receive on the question exams. And I'm not going to lie, it is one of the hardest questions you're going to get on the NCLEX. However, it is also a very positive sign that you're answering a lot of SATA questions on your NCLEX, which means that you're able to answer questions that are high difficulty with the challenges and using good critical thinking skills. So let's get started here today. I'm going to go ahead and take off this camera so you can focus on the PowerPoint. By the way, my name is Susan Caldero. Everyone knows me as Susie. I'm one of the NCLEX instructors, and it's my pleasure to be able to help facilitate today's webinar and coaching clinic. So here we go. So tackling select all the apply questions. When you think about these type of questions, one of the key elements to being able to answer these type of questions successfully is using your 6-step strategies. You need strategies. It's extremely important for that. Actually, I'm going to put my camera back on because I want to just spend a little time here, and I don't have really a slide about this, but I want to spend a little bit of time on the 6-step strategies. All of you should have at least done the webinar that's in Learn Upon by now on the 6 steps to question success. Often when you do knowledge level questions, you think about things like answering the questions and evaluating the questions by answering the first 3 steps. What is the instruction? What's the topic and keywords? Most of you are accustomed to do that anyways. This is how you answer questions on knowledge level questions. You may not think of it in that order, but you're evaluating the question as to what it's asking. You try to figure out what the topic is and what are some details about it. So what do you normally would do next? Let's go straight to your answer choices, right? Well, that is not what you want to do with NCLEX type questions. Here's the reason why. Often when you answer the question using the first 3 steps, you will go straight to the answer choices in the hopes that maybe the answers will give you a clue, will somehow jump out and slap you in the face and say, okay, this is the answer. At least we hope that's how it works, right? Sometimes it might, sometimes it won't. But it's not really a good strategy when you think about questions on NCLEX, because those questions are not based on knowledge, understanding. It's based on how you apply your knowledge. It's understanding the topic and looking for the ideal outcomes. When you look at ideal outcomes, you have to really understand and analyze the question appropriately. Having to skip the step number 4 in our 6-step strategies will cause more confusion by looking at answers without prioritizing or look at evaluating the topic first. When you get to step number 4 of our 6-step strategy, here's where you get to apply your knowledge and your critical thinking. This is where you look at the topic and say, is this an expected outcome? Is this something that should happen? This is something I would expect would happen based on the diagnosis or the medication or whatever the topic is. Or is this something that is not expected? Meaning something's wrong. It requires a little bit more attention to evaluate what the question is truly asking. So if the topic is about an assessment, it's about interpreting that assessment. What does that mean? What does this indicate? Once you've completed step 4, now you're ready to answer the questions in step 5. And this is where select all of the apply questions strategies come in real handy, because unlike the priority or other questions where you can apply nursing process or ABCs, select all the apply questions, you don't have that option. It's either you know it or you don't. One of the things that I recommend that I think would be a really good strategy here is that when you get to your answer choices, make sure that you're justifying each answer. Don't just say, I think A sounds good. A sounds like it's a right answer. I'm going to say yes. Have a reason why you think it's a yes, or have a reason why it's a no. Often if you take that moment of pause to say, wait a minute, why do I think this is a yes? it actually may cause you to think about it and say, wait a minute, but it may not fit this particular scenario situation. And this is where you can get that second check in your mind to say, is this the right answer? So today we want to go through some of the things that are part of Select All the Apply, and how are we going to look at breaking them out and using this process to be able to answer the questions. All right. So without further ado, let's get started. Okay, let me take the camera off now. All right, select all the apply questions. So with these, the most stressful type question, the RN's, in RN's opinion, right? When you're stressed about a question, how do you cope? Do you feel like this lady right here? You want to scream. You go, oh, not another SATA question, please. Do you find that sometimes the questions you were most stressed about, you end up getting right? And while the questions you thought were easy, you missed? What a paradox. Well, this exists because sometimes we get overly confident with those topics that we think we know, that we feel we're confident with. But if you don't properly vet the question, you might end up answering the question incorrectly because it's not what the question was asking, or perhaps you missed a key word. Very important. So study tips is to enjoy the tough questions when you find during your review. What do you say, Susie? Yes. If you're getting a lot of these really tough questions on the NCLEX, instead of being frustrated, be happy. Because if you recall from our other webinars, we talked about how NCLEX works. In order for you to pass NCLEX, 195, what am I thinking? 95% of your questions need to be above that minimal standard, which means that you need to be in using a lot of the critical thinking skills to be able to get those more challenging questions. So the more challenging the question, the more thought-provoking it should be. Just because it's tough is not a reason to overanalyze. That's another testing error that we commonly see, where you're trying to put information to the question that just is not there. As experienced RNs, you deal with situations all the time, and it's just logical and it's just kind of natural to think that if you read a question that there are certain things that you would expect to see, because in the real world, that's how it works. However, on the NCLEX exam, if the question did not provide that information, do not consider it, because that would be considered overanalyzing. If you're analyzing it properly, you should still go with your first instinct. Typically, when you're looking at things, you want to be able to evaluate and the reason why you think this is correct. Be consistent in your question approach. All of the questions must be right to be considered correct. Sorry, guys, there is no partial credit. I wish there was, but there isn't. So even if you get 3 out of the 4 answers correct, the question will be marked as incorrect. On the NCLEX, you need to hope for difficult questions to be given to you. Easy questions will result in below that pass or standard outcomes, as I previously said. SATAs are considered a good sign to get. If you're seeing a lot of them, pat yourself on the back and remain calm. So first, don't panic. Like we said, SATAs are good signs. Read the question and remind yourself that it's going to ask you to use core knowledge. Use any hints and clues to make sure you know what the question is really asking before you start looking at the answer options. In other words, use your 6 steps. What is the instruction? What's the topic? And importantly is, what's the key word? Those are clues. Those are hints. Think about what you know about the topic before delving into the answer options. In other words, think about expected outcomes. What do you know about the topic? For example, if the question was asking you, you're providing metoprolol for a client with hypertension, what signs and symptoms would you teach your client to report to the healthcare provider? Select all the apply. All right. So let's think about this question. Here's a question that's saying that you need to teach your client to report signs and symptoms. What signs and symptoms do you teach them to report? Well, your topic here is metoprolol. The key word is the patient is taking it for hypertension. So going back to the topic, you need to think about expected outcome. Basically, what do you know about Metropolaw? What does it do? How does it work? What is an expected outcome? When should there be a problem? What are side effects? What are adverse effects? You need to be thinking of all of these things when you think about the topic. All right. If you think that that Metropolaw is a beta blocker, you would be correct. How do beta blockers work? Well, we know that they work on blood pressure. Therefore, it seems like an appropriate medication for hypertension because it dilates arteries to allow for the blood flow to lower. However, an extreme lowering of the blood pressure can cause what? Hypotension, right? Now, Metropolaw doesn't only lower the blood pressure, it also lowers heart rate. It slows conduction. That's why sometimes we give beta blockers to AFib patients. So what do? Well, the problem here is that it can cause that heart rate to drop too low and create bradycardia. And thirdly, since beta blockers help with increased oxygen demand and myocardial consumption, it improves cardiac output. That's why we give beta blockers sometimes to heart failure patients. So what a potential outcome is that it can do the opposite and decrease cardiac output. Now let's put all three things together. We have a medication that has the potential of creating bradycardia, hypertension, and decreased cardiac output. Now you're ready for your answers because you've thought and analyzed the question. So what is the question really asking you? What signs and symptoms do you teach a patient to report to healthcare provider? Those signs and symptoms that would be associated with decreased cardiac output. There you go. That's what the question's asking. So now it makes it a little bit easier when you go to your answer choices of what you're looking for, because now you've analyzed and understand what the question's asking. Does that make sense? I hope so. So let's think about extra struggles with sadness. Know that you've done your best and second guessing won't be a good thing in most cases. When you first read the question, try to imagine what you already know about the main topic, like we just explained with the beta blocker. If you feel it helps, try writing down what you know, calm, cool, and controlled. Then start looking at the answer options and asking, is it true or false? Here's another strategy for the SATA questions. This is important. After applying the 6 steps, you've gone through step number 4, just as we did in the example of our beta blocker, and now we're ready to look at our answer choices. Now we want to make sure that each answer we can justify. Can we justify the answer? So if answer A to the scenario that I gave you says dizziness upon standing, that's a symptom. Do we teach our clients to report that particular symptom to the healthcare provider? Dizziness upon standing. Let's go back to our scenario in step number 4. We determined that an outcome with Metropolaw is bradycardia, which can cause orthostatic hypertension. And isn't that a sign of orthostatic hypertension is dizziness upon standing? Yes, that kind of makes sense. I can justify that answer and say that is a correct answer to this question because it makes sense and I can justify it based on my hypothesis. All right? Now, SATA tips, read each question option and answer one by one. So we did the first one, we justified, we said yes to that answer. Let's go, rather than trying to talk ourselves into it, we just want to make sure we're validating that our answer is correct. And then now we're going to go to the next answer choice. It could be one answer, it could be all. Select all that applies. If only one applies, then that's the answer. Don't change your answer. Go with what you know. Go with your instincts. Submit the question without going over it again. In other words, the more you think about it, sometimes you can actually talk yourself out of the correct answer. If you feel confident that you're logical and that you've answered the question with a good rationalization, then you're good to go. All right. So now that we've understand a couple of the tips in answering SATA, which is select all the apply questions, we're going to add our 6 steps to question success. Step 1, instruction. 2, topic. 3, keyword. 4, knowledge and critical thinking skills. And then 5 is when we finally get to go to our answer choices and look at which are the answers, using one at a time, justify your answers. And then finally, step number 6, you want to go back and reread the question and say, does this question fit the answer? So are you ready? So here's our first question. It says, a nurse is instructing a client with depression on the administration of imipramine. The nurse documents the client understands the instructions based on which of the following statements. Select all that apply. And here are some of the answer choices. Number 1, the medication is best to take at bedtime. 2, if I miss a dose, I will take it as soon as I can unless it's time for the next dose. 3, the effects may not be present until I've taken it for about 2 to 3 weeks. 4, I need to avoid alcohol while taking the medicine. 5, I need to change my daily exercise routine to once weekly. All right, so think about this question again, and let's break it down using our 6 steps. So first of all, we need to look at what is this question asking. The question is asking the following statements. It's asking the nurse documents the client's understanding. Understanding of what? What is our topic here? Okay. What do we know about imipramine? How would we reword this? So think about what the instruction, which is our instruction step 1, our topic being imipramine, which is our topic. And we know that this patient, it's an antidepressant. Why? Because our key word is depression. So even if you didn't know what imipramine was, if you identify the key word that the patient's taking a depression, it is logical to make the understanding that it's an antidepressant. So that makes it a little bit easier to understand what you're looking for. So how would we reword this? The nurse documents the client's understanding on how to take an antidepressant. So that's truly what the question is asking, right? So let's look at this question again. Now that we've had time to kind of analyze it, let's see if we can come up with the right answers. Let's do this one together. Remember I said you want to take one answer at a time and justify it. So let's look at number 1. The medication is best taken at bedtime. Well, is that an accurate statement? Is that a yes or no? What do we know about antidepressants? Is that a problem? Do they cause sedation? Is that something that we would be concerned about? Yes. When you think about antidepressants, one of the side effects of antidepressants is also sleepiness. It can cause drowsiness. So it would make sense that the medication is best taken at bedtime, right? So we're going to say yes to that answer. Now, number 2, if I miss a dose, I will take it as soon as I can, unless it's time for the next dose. Well, let's think about antidepressants and imipramine. Let's go back and talk about what is imipramine. What do you know about it? How does it work? What does it do? Now, if you don't know this particular medication, make sure you write it down. And after the webinar, you're going to add this to your pharmacy list and then look it up. Check your pharmacy Made Insanely Easy and look up your resources because you need to understand a little bit about the effects of the medications. So antidepressant imipramine is also a tricyclic antidepressant. And as with most of these antidepressants, they work on blood levels. Blood levels meaning that you want to maintain a normal or a therapeutic dose of the medication in the bloodstream. So it would be important that the patient doesn't miss any doses. Now, if they do miss a dose, we want them to take it unless it's close to the next dose. So the answer to this one would be yes. Makes sense, right? Now, because we know how antidepressants works, we know that there is a potential for this to take a while to build up in the bloodstream. So think about how that affects the patient and how long it would take before we see therapeutic effectiveness of the medication. So yes, it is possible that it can take 2 to 3 weeks before the medication begins to work. So that's a yes. I need to avoid alcohol while taking the medicine. I think this one is pretty straightforward. I think most of us can agree that alcohol really is not good with any medication. So that is a yes. Do I need to change my daily exercise routine to once weekly? Well, remember the question is saying instruction is what's the following statement regarding imipramine and antidepressants? Do antidepressants affect how we exercise? Is that something that's dependent on that? So actually, changing expectation and, is not something that's going to affect the medication. So that would be a no. Okay. So how you doing? Did you all get that one right? Or did you miss some of it? All right. We'll get a chance to try another one. Let's try this one. This one says, the LPN feeds a client diagnosed with left-sided CVA with dysphagia. Which of the following actions by the LPN reflects appropriate care for the client? Select all that applies. 1, the LPN checks the client's ability to swallow. 2, the LPN offers the client apple juice. 3, the LPN positions the client at a 45-degree angle. 4, the LPN offers the client scrambled eggs. 5, the LPN instructs the client to place food on the right side of the mouth. And 6, the LPN turns off the television. I'm going to have you pause the video to give you time to think about the question, evaluate it, and look at each answer choices and justify them to yourselves. Once you've completed that, restart the video and then continue on. Okay, so hopefully you're back after taking the time to read this question and evaluate it. The LPN feeds a client diagnosed with left-sided CVA with dysphagia. Which of the following actions by the LPN reflects appropriate care for the client? Select all the apply. So let's evaluate this question first and determine and look at some definitions. So we're looking at appropriate care for a client who what? Who had a left-sided CVA. And dysphagia is a key word here. So we need to look at what does that mean. So let's think about our topic of left-sided CVA. Think about how the left side of CVA affects the patient. What do we know about a stroke? All right, think about it. So we know a few things, and I'm sure you're thinking in your head, well, if they have a left-sided CVA, it affects what part of the body? Yes, the right side. So a left side of CVA will affect the right side of the body, meaning that the right side has some weaknesses, are the areas of concern. Okay. Now, what does dysphagia mean? Dysphagia means the definition would be weakened or poor swallow. Doesn't say they cannot swallow at all. It just means they have difficulty with swallowing. Okay? Keep those definitions in mind when you're answering these questions. So let's take one at a time. Let's take a look at number 1. The LPN checks the client's ability to swallow. Well, it's the LPN that has been assigned to feed the patient in this scenario. So even though the initial assessment we all know belongs to the registered nurse, the LPN is getting ready to complete a task. And it is the responsibility of the LPN to effectively determine if she can or he can complete the task appropriately. So there does require a sense of assessment. So don't let this word throw you off that the LPN checks the ability to swallow, because it is part of the task that the nurse is completing to feed the patient. If the patient does show symptoms of problems with swallowing, coughing, for example, then the LPN needs to stop and get the registered nurse to come and do a proper, complete assessment and do a plan of care. But in this scenario, the LPN is responsible to making sure that the patient is able to swallow, since they are responsible now for that. So the answer is yes. Okay. Number 2 says the LPN offers the client apple juice. Okay. I can't see your answers because this is a recorded webinar, but I can imagine what some of your answers are going to be. I anticipate some of those answers. So you would probably be surprised when I say that the answer is yes. All right. So I imagine that some of you may have said no because you got thrown off by the word dysphagia, and you're thinking that they may be at risk for aspiration. And in part, you are correct. That is something to keep in mind, that this patient may be at risk for aspiration. But remember what I said about overanalyzing and thinking about that? You don't want to overanalyze and include or assume that the patient cannot swallow and has problems with swallowing. Difficulty swallowing doesn't mean they can't swallow at all. Okay, so apple juice would be actually appropriate for this patient at this point in time. If they start having some coughing or sounds like choking, then you would stop and then you would consider first calling the nurse to do an assessment. Number 3, the LPN positions the client at a 45-degree angle. Well, again, I want you to think carefully about this question or about this answer. Think about your CVA patients. What are some of the risks that we just discussed? We talked about aspiration. And what is the greatest risk of aspiration when you think about patient position? Well, how do we open an airway? If we open the airway when we're thinking about breathing or someone who's going into respiratory arrest, we pull the neck back, right? Because that opens the airway. Do you want to do that for someone who's swallowing with a CVA? Because we want to avoid them to having that go down the airway. So we want to block the airway. So the best thing is to make sure that the chin and the head is moving forward. And when we have it moving forward, we close the airway to allow optimization for the food to go down the esophagus, right? So do you think that 45-degree angle is sufficient? Well, the answer here is not. We want that patient to be up higher, okay? Because we want to make sure that they are not going to be at risk for aspiration. How about number 4? The LPN offers the client scrambled eggs. Why scrambled eggs? Go back to your topic. Someone with some difficulty swallowing would probably need something what? Something easy to swallow, something that does not require a lot of chewing, a lot of use of the muscles that might be weakened from the stroke. So you want to provide things that are easy to swallow, easy to digest. So scrambled eggs seems to be something that would be easy to eat. Now you would not give this patient a piece of meat or something that would require a lot more chewing and more risk for aspiration. How about 5? Instruct the client to place the food on the right side of the mouth. Well, we determined when we read the question that a left-sided CVA would affect the right side. So do you want to put the food on the weaker side or the stronger side? Yes, you want to put it on the stronger side. So you would avoid the right side of the mouth and put it on the left. And finally, the last one, turns off the television. What is the reason for that particular answer? Well, if we stayed with our assumption, our hypothesis that we want to avoid aspiration, we want the patient to be able to concentrate and focus on their eating. So turning off distractions would be a good thing to do here, because we don't want them thinking about other things than eating and concentrating on their muscles and their ability to swallow. All right, how did you do? Did you do good? Are you disappointed? It's okay. We got more questions to practice. Believe you me, the more you practice, the better you're going to get. So here's another question for you. The nurse is assessing a client recently diagnosed with Graves' disease. Which of the following symptoms would the nurse expect to assess in the client? Select all that applies. All right. So go ahead and pause the video and take the time to read the question, add your 6 steps, analyze each answer carefully, and then resume the video. Okay, welcome back. All right, the nurse is assessing a client recently diagnosed with Graves' disease. Which of the following symptoms would the nurse expect to assess in this client? Select all they apply. Well, before we can even look at the answers, we're going to do our first steps. Is what is the nurse going to expect to assess in what? A patient with Graves' disease. That's our topic. So, can you define Graves' disease? Do we know what that is? What does that mean or indicate? All right. So you have to first start with that. Okay. So we know that Graves' disease is really known as hyperthyroidism. Absolutely, hyperthyroidism. So let's think about those keywords. Hyperthyroidism, everything is hyper, right? So think about what the thyroid does. So with a hyperthyroid, we'd expect everything to be elevated, right? So we expect that, patient's metabolism is running very fast. So what would be some symptoms that we would see associated with this particular disease? Let's start with number 1. Amenorrhea. All right. Would we expect amenorrhea with a patient that has Graves' disease? Yes. So here's a patient that would have amenorrhea. As your metabolism is functioning very quickly, it affects many of the hormones, and we look at some of the things that are related to that. And this is one of the things that you would see with patients with a really fast metabolism. We see this also in other conditions like anorexia, for example. They would lose their period because of that. All right. How about number 2? Would you expect to see bradycardia with Graves' disease? If you have hyperthyroidism, would your pulse be fast or would it be slow? It would be fast. We would expect to see tachycardia, not bradycardia, when you think about hypothyroidism. How about an elevated blood pressure? Well, think about the body's way of compensating. Typically, when the body's compensating, you're looking at an increased metabolism, you have increased cardiac output, you have increased respiratory, increased pulse, but you're also going to see increased blood pressure. This body's way to deal with the stressors that come onto the body. So everything moves faster and everything's elevated. How about an elevated temperature? Would that seem associated and go along with the same things that we have talked about? If your metabolism is going fast and everything is moving forward, would you expect the temperature to go up? Yes, it kind of makes sense, doesn't it? It kind of goes along with the same train of thought. How about low energy? Well, we just finished saying that we expect increased metabolism. Everything is faster, so no. This one would be definitely a no, low energy. If you have your nursing made insanely easy, one good thing that you can use there is look at some of the mnemonics and some of the resources that can help you remember some of these different disorders. So if you remember from that, Go Getter Gertrude deals with Graves' disease. You can find that on page 246 of your Nursing Made Insanely Easy. The opposite would be things like mixed edema, when we see a morbid Matilda. So if you can remember some of these acronyms and mnemonics, they can really help you when you're thinking about some of these disorders and what fits with what. So don't forget to use those resources. All right, how are you doing? Good? Let's keep going. Number 4. The clinic nurse evaluates a client's response to levothyroxine after 8 weeks of treatment. What therapeutic responses to the medication should the nurse expect? Select all the applies. Our answer choices: 1, apical heart rate of 88 per minute. Elevation of mood. Number 3, improve energy levels. 4, skin is cool and dry. And 5, slight weight gain. Once again, pause the video, take the time to review the question, use your 6 steps, evaluate each answer, and then resume the video. Okay, I hope you had the time to review the question and think about it. Let's look at this question again. The clinic nurse evaluates a client's response to levothyroxine after 8 weeks of treatment. What therapeutic responses to the medication should the nurse expect? Select all the apply. Like always, we want to look at what our instruction is, what is our topic, and what are some of the following improvements to deal with hypothyroidism. Absolutely. Because when we think about the medication and what is therapeutic, we know that levothyroxine is often used for hypothyroidism, which is opposite of what we just learned with Graves' disease. So before you can understand what are some therapeutic responses, let's first define what is hypothyroidism. What are some of the things that we would see in some expected outcome with this medication? So you think about hypothyroidism, unlike the Graves' disease, everything is low. Everything is low and slow. That's what means hypo. So looking at that, if you're on therapeutic levels of levothyroxine, you would expect the opposite, or at least that the hypothyroidism symptoms would have improved. So let's take a look at number 1. Remember, we're looking at therapeutic responses. 1, apical heart rate of 88 per minute. Is that a yes or no? Well, if the medicine is working and has improved the condition of hypothyroidism, which we expect to see is bradycardia, correct? But it's working better. It's fixing things. So will we see a normal heart rate with levothyroxine at therapeutic? The answer is yes. Makes sense, right? How about elevation of mood? If the expectation with hypothyroidism is that they're having a depressed mood, then the medication working should do the opposite. So elevating of the mood would be a yes. Would you see improved energy levels with therapeutic responses to the medication? Absolutely. Would you expect to see skin is cool and dry? No. That would not be consistent with the medication and having a therapeutic response to that. And finally, slight weight gain. Is that a sign that the medication is working? No, that is a sign of hypothyroidism. However, if the therapeutic level of levothyroxine is working, we would see improve or decrease weight gain. All right? Great. You guys are doing great. I'm sure I can feel it all the way from over here. You're doing wonderful. So hang in there. Number 5, the nurse is caring for a client with a terminal condition who is dying. Which respiratory assessment findings would indicate to the nurse that death is imminent? Select all the apply. Number 1, dyspnea. Number 2, cyanosis. Number 3, Kussmaul's respiration. Number 4, tachypnea without apnea. 5, irregular respiratory pattern. 6, adventitious bubbling lung sounds. Once again, pause the video, think of the question, apply your 6 steps, and answer each answer individually. Okay, we're back. All right, number 5. Nurse is caring for a client with terminal condition who is dying. Which respiratory assessment findings would indicate to the nurse that death is imminent? Select all that applies. So once again, we're going to look at each answer individually and determine whether or not they fit the scenario. So number 1, would we expect someone who's dying, who's showing imminent death, to be shortness of breath? Dyspnea, right? Well, we got to look at our topics again. And the answer would be yes. That's kind of, I think, a very easy answer to expect. All right. How about cyanosis? And remember, cyanosis means less oxygen, so it's definitely a sign of imminent death if there's no oxygen reaching the tissues. Yes. Kussmaul's respiration. What is Kussmaul respiration? To be able to answer this question, we need to start thinking about some of the terminologies that we see here. Well, Kussmaul is, when you get rapid, deep breath, it's typically a symptom of not of death, but something we refer to as DKA. Yes, diabetic ketoacidosis is something more associated with Kussmaul's respiration. It's an attempt to get rid of all the hydrogen ion acidity that builds up with the deep diabetic ketoacidosis, but it's not related to imminent death. So this would be a no. Now, tachypnea without apnea. So this is a fast respiratory rate without stopping breathing. Well, there's many disorders that can cause increased respiratory rate, right? I mean, running, fever, being frightened by something. I mean, there's many things that can cause somebody to breathe faster without having to stop breathing. So definitely is not a sign of imminent death. Now, we have irregular respiratory patterns. This is often known as chain stoking. Yes, it's a different terminology that shows a sudden increase of breathing and slowing patterns and then increasing. So there's alternating of apnea with deep, rapid breathing. This is a very classic sign of someone with imminent death. And finally, number 6, adventitious bubbling sounds. Well, when someone is dying and they no longer have the strength or the muscle strength to be able to get rid of secretions, the secretions can build up, causing that adventitious bubbling sound. We also refer to that as the death rattle. So yes. All right. What do you think? You got this one? Was this one hard? Hope not. Okay. Let's keep it going. How about this one? The nurse should implement which measures to prevent infection in a hospitalized immunocompromised client? Select all that apply. 1, are we going to use strict aseptic technique for all invasive procedures? 2, insert a Foley catheter to eliminate the need to use a bedpan. 3, use good hand washing technique before touching the client. 4, keep fresh flowers and potted plants out of the client's room. 5, place the client in a semi-private room with another client who's immunocompromised. And 6, keep frequently used equipment such as blood pressure cuff in the client's room for the use by the client. Once again, pause your video, think of the question, apply your 6 steps, answer each answer individually. I'll see you back. All right. Question number 6 says the nurse should implement which measures to prevent infection in a hospital immunized client? Now, when you think about hospital immunized client, that is looking at that. So the instruction is what measures to prevent infection, and the topic is immunocompromised client. So when you think of that, these patients, they're a high risk for what? These are patients who are immunocompromised or are high risk for infections. So the goal of this question is to find answers that would prevent or diminish the ability to create infection in this patient. So number one, is this something that use strict aseptic technique for all procedures? Do we want to protect the patient from getting infection from procedures that may be performed? Yes, absolutely. Number two, do we want to insert a Foley catheter to eliminate the need for a bedpan? All right. We all know that Foley catheters come with its own high risk of infection and UTIs. So this is something we do not want to do with immunocompromise. I will tell you that this is something that we see less and less and more in the hospital where we're putting in Foley catheters. Unless there's a really good justifiable reason, Foley catheters are not placed as they used to be back before when it was a little bit more common. Number three says use good hand washing technique before touching the client. Well, I think that's a given. That's best practice, and that's one of the things that we do. Now, this one is a little trickier. I'm sure some of you had struggled with number four. Keep fresh flowers and potted plants out of the client's room. So one of the things that you got to be aware of, especially with patients who are neutropenic and you're doing neutropenic precautions, is to make sure you're not bringing anything that would harbor some kind of bacteria or virus. And flowers and potted plants can harbor some of these bacteria that can come in and be a problem for those patients who are immunocompromised. Number five says place a client in a semi-private room with another client who is also immunocompromised. Well, I mean, we can't be sure that the patients are going to share the same thing. So the answer to this question would be absolutely not. One client placed in a private room. Now, 6 says keep frequently used equipment such as blood pressure cuff in the client's room for the use by the client. Absolutely, we don't want to cross-contaminate by using and taking the blood pressure cuff out or anything else that other equipment use and transferring and bringing in infection. So all these are the answers there. So answers is 1, 3, 4, and 6. All right. We're almost at the end, you guys. I hope you're doing well with these SATA questions, and I hope you're learning something. So here we go with question number 7. The nurse is assessing a pregnant client with a diagnosis of abrupto placenta. Which manifestation of this condition should the nurse expect to note? Select all that applies. Answers: 1 is uterine irritability. 2 is uterine tenderness. 3, bright red vaginal bleeding. 4, abdominal and low back pain. 5, strong and frequent contractions. And 6, non-reassuring fetal heart rate patterns. Once again, pause the video, use your 6 steps, and look at each answer individually. I'll see you back. All right, welcome back. Question number 7 says the nurse is assessing a pregnant client with a diagnosis of abrupto placenta. Which manifestations of this condition should the nurse expect to note? Select all that applies. All right, so we look at each one of these, and you have to first identify the question and understand what it's asking. So, what are some of the manifestations and condition that the nurse is concerned about when it comes to the diagnosis of abrupto placenta? So, we first have to understand what abrupto placenta is. We think about abrupto placenta as exactly the way it sounds. It's a separation of the normally implanted placenta before the fetus is born. So it occurs when there is bleeding and formation on a hematoma on the maternal side of the placenta. So what would be some manifestations? Let's think about it. Some things are just kind of logical. So, for example, would you expect uterine irritability? It sounds like they would be very irritable. Would you expect uterine tenderness? Absolutely. Would you expect bright red vaginal bleeding? Let's think about that one. Remember, it's the placenta high up in the uterus. So would that be bright red or dark red? In this case, it's not bright red vaginal bleeding. This is something you would see with placenta previa, perhaps, but not placenta abrupta. That would be more manifested by dark red blood with clots. Would you expect maybe abdominal and low back pain? As mothers often will feel the pains in the lower back of contractions, it would seem that abdominal and low back pain would be consistent with this phenomenon. Think about strong and frequent contraction. Would you expect that as you would with somebody who's in labor to be strong and frequent? Or would it be infrequent? And would they be strong? So the answer here is no. This is a person that may not have, it could be painless. It could be pain, but in contractions, but it would not necessarily be frequent. And then non-reassuring fetal heart rate patterns. Do you think that this phenomenon would cause changes in the fetal heart rate? Would it affect the fetus if the placenta is separated from the wall of the uterus? Absolutely. So we would definitely see non-reassuring fetal heart rate patterns. That's something that we would consider carefully. All right. Well, that brings us to the end of our webinar today. Well, we hope that you learned something today, that this was helpful to you in using strategies when answering select all the apply questions. So a quick review: when you're looking at a question, select all the apply, always apply your 6 steps. Think about expected outcomes when it comes to your topic. When looking at your answer choices, you want to go through each one individually and justify your answer. Why is it a yes? Why is it a no? And as you continue moving forward, the more you practice it, the better you're going to get. So remember, don't be fearful. Don't be discouraged if you're struggling with SATA questions. They are hard. And like I said, the more you practice, the better you're going to get at it. So until next time, thank you so much for joining this webinar today. You can repeat it anytime. I hope we learned something today. In the meantime, you all stay safe. And from Susan Caldero to all of you, bye. Stay safe.